Welcome to the Artist Forum. I'm Monique Martin, and our guest today is Dr. Jasmine Bowers. Welcome.
Thank you. I'm very happy to be here.
It's a pleasure to have you here as we look to have a conversation around wellness and around navigating the medical system, which can appear to be daunting to many people, and looking to see what are a few things that we can do to kind of demystify what may seem to be an overwhelming process for many people. And not only are you a practicing anesthesiologist, but you also are an advocate. Your current passion is advocacy. Can you talk a little bit about that journey from being a practicing physician to patient advocate?
Well, it's been a long journey, and it has taken several turns, but it over the past 20 years has taken me to this point, and I'm happy to be here to share on both sides of the stethoscope my experiences and also to educate the healthcare consumer, which is now the new term for the patient, and also be a provider, be an advocate for the healthcare consumer, and also be an advocate for myself and my colleagues as healthcare providers.
What's interesting about the term consumer, just as I'm hearing it, it feels more empowering than a patient. There's a vulnerability that comes with being a patient, and we all feel vulnerable going in to see our doctor, even if it's a routine annual checkup. So being a consumer, it just sounds as though you have a little bit more choices and more power. So
Correct.
Can you talk about how do you get from the mentality of being a patient to being a consumer?
Well, that is exactly why the terminology was changed. Because as a patient, a doctor-patient relationship, the patient is the child and the physician or the healthcare provider, it would be the parent. And in that model, the patient feels helpless, not responsible for their healthcare choices, and passive. As a healthcare consumer, everyone understands that as a consumer, you have options, you can ask questions, you have the ability to research your medical condition, the medical history of your family members, and you have the right to choose, with the Affordable Care Act being present, thanks to our President Barack Obama.
Mm-hmm.
So with these choices, if you coin the term consumer, then people tend to understand that. They tend to look at healthcare and look at their participation in the healthcare arena differently. And we want patients, or we want the healthcare consumer to be active participants in their healthcare.
And when you talk about being an active participant, we're looking at the arc, starting from wellness, being proactive in maintaining wellness, to navigating any kind of illness, and then post, as it relates to breast cancer. There's a term that I was interesting that you mentioned, breast cancer survivor, and looking at how, although you may be in remission, there still is active work to be done. So we can relate that to any illness. So I guess I'm asking for you to kind of look at those three stages, and what would be your advice to the consumer?
I think in the past we've sort of ignored, as you mentioned, there is a spectrum of health and wellness, disease, and treatment or cure. So we tend to interface with healthcare, with the healthcare system at the disease state. Mm-hmm. We need to consider interfacing and participating in the healthcare process during the health maintenance and health wellness state. We need to look at lifestyle changes. We need to look at our dietary habits. We need to look at the guidelines that have been already laid out for health maintenance of our children and health maintenance for us as adults. And they even break them down to gender and age, and the information is out there, it's available. So in doing that, it encompasses a lot more than just disease. It looks at prevention. As you move along that spectrum and by chance you develop a disease, an illness, such as hypertension or diabetes, you're now looking at treatment. Again, as the healthcare consumer, you can look at options. You can, and in fact you should, ask questions and make sure that you understand as a consumer what it is that you're taking. What are all of your options and alternatives? And if there are any research opportunities, what are they? In addition, if you are offered research opportunities or if you are offered experimental medication or procedures, you need to have informed consent and you need to understand fully and completely what it is that is being offered and what is the expectation as a participant and what are the possible outcomes. Then as you move towards the long-term effects of your medical illness or diagnosis, and possibly you're looking at a period of time by which you are now cured or healthy or back to normal, you need to not fall off the healthcare radar. You need to look at maintenance. You need to look at follow-up. You need to look at continuing in the healthcare process, but more for observation and maintaining that healthy state, if you will, for you and your family members.
It can appear to be overwhelming when you are doing research on your own or talking with your physician. And if you don't have a primary care a caregiver at the Artists Forum, there are many artists and other freelance workers that work in different sectors, the art sector as well, that may not have a primary caregiver or insurance. So we've just come through the Affordable Care Act and all of the logistics with that, the technological challenges, and then the success. I know many friends and colleagues that now have insurance that did not have insurance before. So what would you say if you don't have someone that can kind of hold your hand as an advocate, some maintenance? So there is the annual, your annual checkup. Would you say that blood work is something that is you would advise? I mean, I'm not asking for advice advice that is a blanket advice for anyone, but surely there are wellness initiatives that any consumer can begin now.
To speak to that, the Affordable Care Act, part of its objective is to provide health care for the uninsured. And even though the literature or the information is daunting, you know, by all means, and they're still trying to figure it out, but it's a process by which once you apply, there's so many opportunities for providing some level of basic health care coverage, which has now become your right or an option. If by chance you're not navigating through that system or that process and you're doing it uninsured, there are free clinics, there are a lot of grant-sponsored clinics, there are a lot of major areas of study, you know, medical institutions around here. You have Mount Sinai, St. Luke's, Roosevelt, you have NYU, you have Columbia Presbyterian, to name a few. They may in fact have healthy outpatient clinics or outpatient centers that would allow you to come in and get screening for basic health issues, screening you for your blood pressure, screening for the presence or absence of hypertension, screening you for your weight, deciding if you're of normal weight or not, screening you for factors that may predispose you to diseases such as hypertension and diabetes. So there are those low-cost opportunities that you can participate in without being part of the Affordable Care Act or without having an existing healthcare plan. But ideally, as you bridge the gap, use one or the other. But you do understand that at least once a year, you should have some basic screening, a basic checkup. Oftentimes, we call them off-site centers. If you go to a Walgreens or a pharmacy, they'll have a little booth to the side where you can sit and they'll check your blood pressure. They'll do what we call non-invasive testing, but they'll check your blood pressure, determine your heart rate, and as you sit there, they'll determine what we call the body mass index or the BMI, because you're sitting there, they're weighing you. You fill out a little questionnaire and they'll give you a BMI. That in itself is sort of like a screener, if you will, for certain diseases. And what they're looking at is the presence of normal weight versus unhealthy weight. And they'll print you out a list of potential risk factors. You can also go to different websites, but then that's a challenge if you're not computer savvy or if you don't have access to the computer technology, but that is available. And in fact, if you go to your public libraries, you can actually access that information through the library. So there are some avenues for free information and for low-cost screening. There's low-cost screening mammographies for women that are of the screening age for breast cancer.
And that would begin at 40, right?
It's at 40 if you have, if you do not have a family history of breast cancer, but it actually is younger than that if you have a family member who has been diagnosed and treated for breast cancer. So there's no just standard, they're guidelines, they're always considered guidelines, but depending upon your family history and your history, the guidelines are just that, they're guidelines. So
I know you just have come off of a speaking engagement at FAMU.
Yes.
And can you talk a little bit about your passion around wellness in the youth population and young people that may have been, used to their parents, now managing and navigating all of their their medical wellness, and now they're on their own. So we don't want them to, of course, wait until there's an issue. What did you find in that population in addressing them and some things that might come up?
That was very rewarding, I must say, because we take for granted that our young people, when they go off to college, that they have all the tools that they need. But in fact, they don't. For many of them, it's their first time away from their family and loved ones, out of their hometown, and they get together with other young people that are in a similar situation, and there is the whole idea of wanting to fit in, wanting to participate, but maybe not having the skill set of fitting in and knowing their own boundaries. And that comes out particularly when they have to make choices, social choices, such as drinking, drugs, smoking, unprotected sex, being potentially in a relationship or meeting someone that they feel could potentially be a partner, and all of a sudden that person becomes abusive or violent or yells at them or something like that. These are things where they're trying to figure it out, and oftentimes they don't know who to go to. They may think that their peer knows, but their peer may not know any better than they do. and they may be afraid or ashamed to go to their parents. So,
or the faculty, which is similar to the patient doctor-patient relationship.
Correct. Mm-hmm. So what I'm advocating for, or what I'm encouraging, there are residence hall managers that are the go-between, if you will, for the students in the dorms, and say faculty or a physician. They may not have a physician as of yet, but if that person's not there, there are 24-hour hotlines. There are community centers. There are resources on campus that they should seek out.
And they often can be anonymous.
And they can be anonymous.
Sure. Mm-hmm.
And if they have any questions, they should seek help and guidance. And they should know that if you're drinking, and if you're drinking to fit in, you have to reconsider, why do you need to do that? If you are drinking and you enjoy drinking and you can drink excessively, if you will, make sure you have a buddy. Mm-hmm. I mean, there's certain basic things that we really need to be mindful of. And as recent as the last couple of weeks, we had the young co-ed in Virginia who's still missing. And this is 2014. Mm-hmm. So it's not something that used to happen. It's something that happens, and depending upon who you are and what school you're at, you know, people will be aware and knowledgeable and concerned. Look at the NFL. Yes. The situation with the pro football player and his fiance, who's now his wife. That didn't just happen with that particular video. And again, we have to look at violence as a health. It's not just a social issue, it's a healthcare issue. Street drugs, as I spoke with them, street drugs are just that, street drugs. They're not monitored, you don't know what's in them. You need to know what it is that you're putting in your bodies.
And how would you define street drugs? Is that drugs that you would get in a club, social drugs? Anything
that your primary care doctor does not give you.
Got it.
Okay.
Yes.
And even some prescription drugs, if they're sold on the street, they're street drugs.
Sure.
They're not meant, the prescription was not written for you. So, and I was told that the young people of today, they prefer the prescription drugs. They buy them on the street, and they prefer them because they know they are prescription drugs and they know what's supposedly in them. But they are misusing them if they're buying them without having their own prescription.
Right.
So again, I mean, these are lessons that are learned, but unfortunately, these challenges or these tragedies happen again and again and again. So if there's anything that we can do to try and save, if we can only save one student, you know, that would be great. But if we could educate the whole community of a campus, that would even be better. Mm-hmm. The other thing is tattoos. And they were surprised when I mentioned that, because they're thinking, well, they have disposable needles. Yes, but the ink, they're still dipping into the same ink pool, and the ink can be tainted. So you have to really know, or at least be aware and be adamant that not only are the needles clean or disposable, but the ink is also disposable, or it's a new batch, if you will, for your particular tattoo.
Mm-hmm. So that would go with having due diligence with going to a tattoo
correct
parlor that has a reputation for sanitized needles, and also with the ink and keeping that clean as
correct.
Well. Yes.
And oftentimes they don't think about that. The other thing is HIV and AIDS is still very prevalent. Because we don't hear about it, we think that it's not present. It's very much present, particularly in heterosexual relationships. It hasn't changed with the young people that are using IV drugs, but also you have heterosexual relationships where one partner is not being completely honest, and our women are getting exposed.
So the numbers have not decreased in HIV,
HIV
being
AIDS.
Contracted,
Correct.
With young people and all ages, actually, right? So
Correct.
what I think I hear you saying is that that is not a hot topic in terms of what we hear in the media.
Correct.
But it still is very challenging in communities of young people, communities of color, across the board.
Absolutely. Across the globe.
Yes.
In Africa, it's pandemic. But if you don't hear about it, you don't think that it's relevant, but it's very much relevant.
There's a conversation and debate about traditional versus non-traditional, Western versus non-Western medical alternative medicine and practices. Can you talk a bit about that and what your thoughts are on that?
Absolutely. A lot of non-traditional medicine has paved the way for traditional medicine. Medication and treatments have come from some of our medicine men or herbal doctors. Even back during slavery times, the American traditional physicians learned from the African healers, in fact, and actually had better outcomes in terms of delivering healthy babies, even back during plantation days, than the white physician practitioner. So there definitely is validity in non-traditional medicine. The American Indians have it, we have it, the Latinos have it, we have it in the West Indies, and we have it also in Africa. We have chewing bark that treats sickle cell crises. We have there are herbal teas within Chinese medicine that is good for pretty much every, it depends on the malady, but it can treat headaches to anything from a headache to, some serious illness.
Would you say chewing a clove of garlic would be considered non-traditional if you feel a cold coming on? Not to give any diagnosis, but I think sometimes people get a bit, again, overwhelmed by how far left do you go, how far right do you go?
Well, chewing garlic certainly would not hurt you, but I would not chew garlic in place of still going to the doctor. You may chew garlic or use non-traditional medicines and teas and treatments for maybe the first 20, if you feel that it's a minor illness or minor ailment. But if it's something that persists and becomes worse, then certainly I would not avoid or negate traditional medicine. But it is certainly a viable alternative, and it's being recognized more and more that when we blend traditional medicine and non-traditional, that it actually works quite nicely. There are in fact physicians or oncologists that will blend chemotherapy with non-traditional medicine to help with the side effects of the chemotherapy. They still get the chemo, but they may get some what we call non-traditional medicine, homeopathic medicine. At any time you go to a health food store, you can see how expansive non-traditional medication has expanded. Lotions, tonics, things of that sort.
Even hair care and cosmetics as well.
Right.
Whether you are insured or have insurance, keeping track of your medical records, oftentimes we as patient, not as consumer, think that it's the responsibility of the healthcare provider. What are your thoughts on that?
That is very far from the truth, particularly during this time of the computer technology and the electronic health records. Even though we've moved into the 21st century with regards to technology, we still need to have, this is even more important for the healthcare consumer to maintain their personal medical record keeping. And I cannot emphasize that enough, because the computers may not talk to one another. You may be accessing one system. You may be in another city, state, country. You need to know your medications, your past medical history, your surgeries, just basic information, your allergies. That needs to be accessible some kind of way at all times. And with our smartphones, what I find, which is very easy and is easy to do for the our elderly loved ones, if you will, is write it down, make a list, write it down, use your phone, take a picture of it, and then you'll always have it, and it makes it a little easier. And I cannot emphasize that enough. As well as, on the flip side, your visits and your time with the healthcare provider is somewhat restricted. You're not free to sit and talk for, you know, for an extended period of time. And oftentimes you get nervous. So write that down. Write down, you know, what's wrong with you, what is it that's being recommended, and why do I need to do or take what it is that has been recommended.
So you're saying going in with some notes and also taking notes during your visit.
Right, be proactive. And if you're nervous and you don't feel that you can do it, again, bring someone who can be there by your side, particularly if you're facing something that's very serious, if you will. If you're looking at a cancer diagnosis, you may be overwhelmed, and there may be a lot of information thrown at you that you may not be processing at the time of that visit. So you need an advocate, a family or a personal advocate, to be there with you and support you.
That's a great tip, to take a photograph of your medical history. I think that would also include blood types. It's interesting how there's so many people that don't know their blood types. So thank you for that tip. So you're moving across the country, speaking about wellness and patient advocacy, and also you have a website that people can go to. We want to make sure that if people have questions, our audience has questions, you can get in contact with Dr. Bowers for any follow-up or any advice. I'm sure there are many people that have questions around wellness and maintenance and having a stronger relationship with their own health care and also their health care provider. So we thank you for your wellness and your wealth of information that you've brought to the Artist Forum today.
Thank you so much.
Our guest today has been Dr. Jasmine Bowers, and this is the Artist Forum.